Hi, everybody. Thank you so much. What a beautiful day. We come, and all of you would say the same, that cared for staff make care for patients, and that care is at the heart of everything in the NHS, all the way around. We are two of very many who have worked really hard over the last few years to improve the staff experience of our staff at UCLH. And we have, including volunteers and lots of other honorary and other contractors, we've got over 15,000 staff and quite a few large hospitals, which a number of you will also have large organizations. So we're just going to share a little bit about the story. I'm Jane, this is Faith. And first of all, we can't do that without, as I said, thanking everyone around us. We've had support from our charity. It's one big team effort across our trust. We work right across with no boundaries to do the things we need to do. So thank you today for PICA and the awards, but thank you to everybody on there. We have over 300 Wellbeing champions, for instance, and lots of other people that are involved in this initiative. The way we work is, if we go back, we'll just do a whistle stop. The way we work is that every voice counts, which sounds cliched, but staff know what's needed. We know that often health and well-being and other things can be a bolt-on, and we wanted to mainstream it to be normalized care for staff and care for patients. Yoga or 24/7 food, yoga or better toilets, no problem with yoga, and we do have yoga, but the staff needed the toilets more and the 24/7 food. So we put some standards in, which we've taken a few years to work at, to better the basic standards so that staff could access simple things like water during their shifts, like toilets, like a prayer room, like a breast milk expressing room for our returned staff from maternity leave, and all those things that make a difference for staff. And as I say, we work as a system, so we work with, and Faith will say a bit more, but we work with our estates and facilities, we work with our dietitians and nutrition, we work with Oc Health, we work with everyone and anyone that can make a difference for staff together. So during this journey, we also do a lot of testing and what you might call, we just see whether things work or not. And we ask staff to tell us, and they are super honest. And they have told us many times, no, we don't like that. That doesn't work. You've missed the point. You're really not helping us help patients. And we change things based on their voice. In fact, we don't do anything unless we have staff voices. They have driven this work from the beginning, and they continue to drive us, and we are accountable to staff for what we do. So that's the crux of this. I'm just going to whiz through a few of these slides quickly. Probably we don't need some of these. We've done quite well as an organization at UCLH. I'm not going to dwell on some of these slides, but we have done well. And we've worked over the last 5 years to push up all of those markers. And we're very specific about measuring and monitoring and looking at where we can have an impact on those markers. We do a lot in terms of understanding what makes a difference and what changes the outcomes. And yeah, we've done quite well on a few things, and for some of our other wellbeing work too. And we're very lucky to be supported by a brilliant top team who are always behind us and behind the work, and great examples. And some of you will have seen the NHS Employers amazing resource here, and we look at it as a triangle ourselves and have done for a while. Physiological needs first, security needs, and everything else that is needed, and we work through those very specifically. This is our Be Well program. This was born a few years ago. Faith is going to talk a little bit about some of the work streams. But in the middle of that is our health and well-being. We take every single thing in the staff environment as well-being. So whether it's cost of living or whether it's to do with their spiritual needs or faith or cultural needs, or whether it's to do with very practical needs like a hot drink or having a fridge or having a microwave. Sorry? And so we, all of that there, and you'll be able to see it on the presentation, has everything on there is to do with well-being, and we've been really careful to make sure all parts of staff's life are on that. And that includes things like traveling to work, security with walking between hospitals, having free bike maintenance, making sure people can have access to hot drinks, and we do promos and things like that as well, hardship funds, a whole range of other cost of living things. So there's a huge amount, but we've built all of that from listening to staff and trying and testing. I'll hand over to you, Faith, and I'll hold this. You've got 5 minutes.
Okay. So I just wanted to say that this is our wellness wheel. This is our wellness wheel, and it's a resource that we often get asked if we can share. I'm still not sure whether we are able to, but please do say, oh, we can, great. So please do take inspiration. Staff have found this so useful. It's an interactive resource that they can click on and find everything that we have to do with wellbeing. So I won't be able to talk to each of the points, but you can see we have quite a comprehensive program. So we look at, as we see in the wellness wheel, we look at the full comprehensive needs of staff, and we have initiatives to support each of those, which include, like we've mentioned, giving access to out-of-hours food, providing a kindness, civility and respect program, which includes lots of communication skills training. We have a huge program of wellbeing champions. We now have one in every single division. Super happy with that result. We also provide psychological support, which is just a huge wraparound program. We cannot cover it in 10 minutes. If we present on this, we usually do for an hour or two. This is a breakdown of all the different initiatives that we did, from small things like delivering thousands of water bottles to really, really huge programs that have been conducted over a couple of years. Amazing, thank you. We made sure that the program aligned also with the People Promise and with the NHS England Health and Wellbeing Framework. I think they kind of came out at the same time. We sort of maybe slightly got ahead of them, but it turned out everything had already aligned, which was really, really supportive. Again, I won't be able to go through each of these, but there's been huge, huge benefits, both in the staff survey and in individual evaluations that we've seen from staff. We always say that one size does not fit all, so having a really comprehensive program so there's something for everyone has been absolutely incredible, and we could just talk for hours about all the different things that we've done. And I've just got some photos. So one of the initiatives that we did, and this is a really big piece of Be Well, is we have Joy at Work, or Staff Wellbeing Fund, where the staff get to decide what they do. And we've had staff going axe throwing and bowling, going out for dinner, all sorts of amazing things. We've got lots of very happy faces here. And here's some other pictures just from where we've updated break spaces. Staff have been very happy with that. Or we've held wellbeing roadshows to promote everything that we do. There's a very embarrassing photo of us on there when we got our first smart fridge, which would take about 18 months to get in, which was really, really impactful to staff. So yeah, we're very, very fortunate to, like Jane says, work with a huge array of teams, about 20 different teams involved in the program, and just see such fantastic benefits for all of our staff. So thank you very much for listening.
No worries. Great job. I'm loving you. I'm loving you all.
You too.
Right, so we finished well on time, so we have an opportunity for some questions. And just to let everybody know, all of these presentations are being filmed and they will be available on the website. So, because I know there's quite a lot to take in sometimes, but you'll be able to peruse these at your leisure at a later date. So, questions? Right, okay, we've got...
Good morning. As someone who used to be a member of staff and is now a patient, could you tell us a bit about how you balance staff being at the heart of everything you do with patients being at the heart of everything you do?
Yeah, thank you. We are also accountable to the patient experience, what's it called? It's called PEAK, Patient Experience Executive Committee. So we work with them. We have to present to them, talk to them, and work very closely to ensure that as they track patient experience, as they have, whether it's complaints or feedback from patients, that we align. So we're very lucky to have a really great patient experience team who we've involved right at the beginning. And some of our work streams, like the violence prevention, reduction, there's quite a few other work streams, we have the patient experience and some patients on some of our committees as well. So we do make sure that's aligned. We also involve governors and our public governors who also feedback. We get them involved, particularly in things like staff recognition. We get public governors and patients involved in that too. And patients can nominate staff for awards and things like that. Faith?
I just also want to add, kind of from a sort of individual and sort of team level, it's not always perfect. We can't always choose the staff over the patient. Often we have to choose, make a choice. But the reason why we have things like the Wellbeing Champions in place is to have a direct link with those staff making those choices and us making certain choices, and try to bring those together and be creative and innovative. So I ran a lunch and learn the other day about taking breaks. Some people found the information really helpful. Some people were like, there's no way that I'd be able to do that in my area. So I said, okay, let's have a one-to-one, let's see how we can make some of this fit in your area, so that actually you're not always having to choose the patient over yourself consistently, because it leads to burnout.
We have two more questions, so I'll have two quick questions, and then that lady in the Oh, hang on. All right, well, let's have some very quick questions. Then you take yours.
We'll do
Let's
quick
do very
answers.
quick. Very quick questions, very quick answers.
Yep.
Thank you and congratulations on your award. My question's in relation to the retention and attraction of staff to your organisation. Do you have any data that supports the effectiveness of that?
In terms of why people, I don't know whether it's so much quantitative data, but qualitatively when we talk to new staff, because the work we do is presented at induction. We get to meet new staff when they come to collect their badges and other things. And we do have a number of staff who come because they wanted to work at UCLH because they've known that there is a care for staff. So there is a reputation, but I haven't got quantitative data.
Also, good word gets around.
Okay, we seem to have an awful lot of questions. So
We're around.
On this side of the room. So, ladies, I'm really sorry.
We'll be over there.
We'll be around at lunch.
Thank you for the opportunity to ask a question. I really enjoyed your talk. I thought it was fantastic, and it's so good to be investing in the teams that we work in, because we've seen situations where we lose people because they can't keep working in an environment which isn't an enjoyable one for them. But a question comes to mind is linked to the question about patience. What's your experience with allocation of resource? Because everything takes resource and money. How have you managed to find the resource and sort of triage or allocate the resource to the right users? You mentioned, I think I picked up on free bicycle repairs and things that really kind of no doubt resonate with staff, but I'm sure a lot of us in different NHS trusts will meet resistance because there's no resource for these things, which is a mistake because you've got to invest in the teams. But I'm interested for your experience with that issue.
Right from COVID, when we started having more resource, we built lots of relationships with a couple of the charities that we have, but also we have a local business district and we have other things. Basically, we look for where we can get money, but we don't use sponsors, but we really look for advocates and support. So that's one thing we're very keen on. Because we ask staff, so if we are going to spend money, we ask staff what they think about it, because if they don't think it's going to work, we won't do it because we won't waste the money. So we have that backing. But the other thing is that we're quite creative. We do a lot of stuff by walking around and then by maximizing what's already there. So like the new hydration and diet, food and hydration strategy, You know, we're very creative around what we would do to maximise that, and the same providers that could provide the food in all our local cafes in the hospitals, they could provide Greggs type food, nothing wrong with it, but we work really hard to make sure every choice that is made that might just be a normal choice has that staff in mind. So it's more like a really conscious, not that everyone wouldn't be, but we look everywhere at where we can maximise what's already going on to turn it into something that benefits staff. Thank you.
Also, Wellbeing champions are free. You get the passion.
Thank you, ladies.
Thank you so much.